thank you for still staying. I'm Intan from Department of Anatomy. I'll be the moderator for the second session. To continue with today's program, I'm honored to introduce Prof. Murali Naidu, a professor from my department. He has been working in neuroscience research for his entire professional career, and today he's going to share with us a presentation entitled Current Challenges in Teaching and Learning Human Anatomy. The airtime is yours now, Prof.
Thank you so much, Dr. Intan. Let me share my screen. Thank you so much. Actually, my main research interests are few. First of all, into neuroscience, I do mostly neural regeneration, the mechanisms, and including optic nerve regeneration. And also, I've done some work on natural products that can improve neural regeneration, especially using the medicinal, the mushrooms. And a few of my colleagues, they gave earlier a lecture, earlier talk on this a few weeks ago, I think. And then I got a keen interest in this cognitive neuroscience of teaching and learning, including clinical anatomy and anatomical education as well. And I do some work on implant and oral maxillofacial surgery as well. Now, as for today, I'm going to talk mostly about what are the challenges, current challenges of facing for teaching of human anatomy. Now, as you all know, anatomy is a visual science. The best textbook to learn human anatomy is the human body itself. Right now, this is if you've been here like decades ago, this is how we learn human anatomy by a dissection, and currently we use the models and also there's some of the plastinated specimens. Now, human anatomy itself is a visual science where we use the senses. I'm sure many of us have this experience where we used to do the dissection like this, shown in this picture, where you can feel the difference when you make an incision, when you cut through the skin, the connective tissue and bone, you can feel it. This is how we use our sense organs to learn. For example, you can feel the pinch, the needle prick, and so on. So anatomy being a visual science, we use our vision, our hearing, our motor skills, including the cognitive part of our brain as well. Now, apart from that, anatomy is also a language where you introduce a lot of new terms. For example, like the ocular, buccal, oris, nasus, mental, axilla, brachium, and so on. So here the students are exposed to both the visual part of it, and also learn the language of anatomy for later for the clinical use as well. Now, the main challenges we are facing, I'm sure many of the anatomists may agree, is first of all, each and every student learn differently in a class, for example. Some students are more visual. If any are giving them a lecture or even an instruction, you can see them drawing and all those. Some are more of a listeners. They prefer to learn. Some are verbal, some are physical, some are more into logical, some they learn in groups, and some prefer to be solitary. So each and every student learn differently. Now, during the lockdown last few years, I'm sure many of us have these experiences teaching online. Being a visual science, teaching online had got its own issues as well. Everything from a technical issue, online instructions, getting feedback, and all this we have gone through it, and including one of the most difficult part I myself encountered during online teaching is the student engagement. When you have a class like 180 over, they are online, it's very difficult to know whether students are engaged. You just, you can't really communicate much except through the texts and so on. Yeah. So these are the challenges we went through. And some of the students, when I talk to them, I've been teaching over 30 over years anatomy. It just, in a casual way, many found there's too much for them to learn. Some of them are involved in extracurricular activities. Some are halfway through, they may lose interest because there's too much information. And some may have to handle personal issues, including health, family, financial matter, and so. Now, all this may give to poor focus for the student. Another issue we've encountered is the forgetting problem. What we teach in year one, when I ask them again in year two, many of it is already forgotten. And this is been like documented by one of the scientists, Herman, where he actually charted a graph known as the famous Ebbinghaus forgetting curve. Immediately after you give them information during the lecture, usually the recall is about 100%. And then within like 19 minutes, it's only half. And if you ask them the next day, most of them can remember only like 30 over percent. And after a day or two, after a week, is almost like a 20 over percent. So this is a normal phenomena. But how to improve this is only through repetition. Okay. So this here he has charted a graph again. When you repeat once, you remember more, two, three, and so on. So, like what I said, anatomy being a visual science and a language, one of the best way to learn is through repetition of the information. Now, and then this again, if it goes, this why we always insist, we tell the students, please read before they come for the lecture, and please go back and read again and to review as well. Now, regarding learning pyramid, the different ways of teaching may have a different retention rate as well. According to this particular the diagram, the lectures has the least, and the highest is probably by teaching others. But the students actually go through all this. They have their lectures, they have the online reading session, they have a video online for them. We have a demonstration, we have a group, the session with them, especially like PBL and so on. And also and also other teaching method as well. So we engage students through all these different learning ways. Now, at the same time, like I've been teaching for over 3 decades now, there are generation changes as well. When I first taught in 1990s, the way the student learn is rather different. And now we are dealing with the generation Z, where they are mostly raised through the digital economy, and they prefer to, most of them come even to the class with their iPads and and the pencil as well, and they prefer to do their learning online. But now, other issues we have, being a very established medical school, earlier on we used to teach using the cadavers. But the last few years been very difficult to obtain the cadavers. There are very few donors. Then there are also concerns about infection and also formalin exposure as well. Then we have then we had to buy dry medium, for example, like models, charts, and the plastinated specimens. And we were actually looking at some of the learning tools available in the market. For example, like online anatomy, the Anatomich, we use the digital anatomy, and a big, huge, the tablet-like teaching the platform as well. And then some of the universities also experiment into a holographic human anatomy, where you can actually project the image of the human body and learn from that. Some are experimenting with augmented reality as well. And now, currently, the students have access to the Lecturio, which is an online teaching platform where they have short lecturettes, okay, and together with the teaching atlas, the quizzes, and so on. And then you have others in the market as well, for example, like Adam Interactive Anatomy and so on. Now, but all these equipments are expensive. Okay, we need the budget, and for the students as well. So we need a budget to buy, as well as for the maintenance as well, including we need to upgrade the hardware and the software. So all this can be very expensive for them to learn. Now, what about in the future? I'm sure you've heard about OpenAI, ChatGPT. Now, I think it was released somewhere last year in November, and it's picking up very, very fast. So it's here to stay. So these are the publications which came recently. The rise of ChatGPT exploring its potential in the medical education, and the future of medical education research is a ChatGPT, a blessing or a blight in disguise. So all this is yet to see, okay? Because the technology can be a double-edged sword. It can be beneficial or wrongly used, and something it can be difficult, right? Then you have early application of ChatGPT in medical practice as well, including education and research all are coming. So we are here in the in the era where we hear about this artificial intelligence a lot, and versus human intelligence as well. Now, so all this is all are coming. Now, another issue we have, especially among teachers of teaching anatomy, we're teaching too many the courses. One of the solution recently, our neighboring university, NUS, what they did was to have a common curriculum. There's basically a common curriculum for the medical students, the dental students, the pharmacy students, the nursing, all sitting and learning together. So with that way, we can minimize where the teachers are being asked to talk too many courses as well. Now, what about other points to remember? Now, the main organ involved in teaching and learning is the human brain. So the human brain generally is about, has more than 100 billion neurons in the cortex. It weighs about 1.3 to 1.5 kgs and 60% of its fat. It transmits signals at about 270 miles per hour. It has unknown storage capacity. So all this information is processed, like all the anatomical information through visual, audio, tactile. All this give the students a learning experience. So learning is just not about facts. It has to have experience as well. Like what I mentioned earlier, anatomy being a visual science where the students that come in and they and they look at the specimens and the models and so on. So when they go through all the processes, so the learning becomes an experience. Now, their experience is again is involved evaluating, analyzing, applying, understanding, and most important to remember as well in the parts of the brain. Now, again, the students, like what I mentioned earlier, have a different learning style. So we have to also cater for that. And one of the important thing, which is we are developing, I have a student actually working on this. This is learning how to use the cognitive load. The cognitive load can be divided into intrinsic load, extraneous load, as well as the germane load. How the whole the load. Say, for example, I'm sure we have gone through experiences. We may find certain topics or lectures more heavier, and the topics or lectures could be lighter. So how are we going to measure this neuroscientifically? So this come under the cognitive load theory and also involving the measurement. So this is how the brain actually processes the incoming information. If it's not importantly forgotten, and then you need to do the remembering part, and in order to have the long-term in a memory. So here is what is important is due to the current challenges the students are going through, which are a lot of informations and so on. So the cognitive load is important in preparation of the teaching material and also design. So this is just a general scheme which is being was published some time ago. How the lecturers can actually prepare, deliver, initiate to end the lecture as well using the cognitive load theory. Now, important part we have to consider, like the teaching and learning involve the human brain. So the neuroscience part is very important. So the key this principle is to, from point of view of neurobiology, learning involves changing of the brain, especially the neuroplasticity as well as neurogenesis as well. And moderate stress is beneficial for learning, while mild and extreme stress are detrimental for learning. So it's important for students and the lecturers as well to have adequate sleep, nutrition, exercises to encourage robust learning. And active learning takes advantage of process that stimulate multiple neural connection in the brain and promote memory. Now, one of the important ideas or concepts can be incorporated into our, especially for anatomy teaching, is to use brain-based learning, or we teach according to how the brain and the mind works. So this is roughly a scheme to show how we can prepare and teach learning material as well. And the neuroscientist Dr. John Medner, I'm sure you may have probably read his book. There are a few books on it. How if you're in education, you're in business or the brain development, if you're a leading and a modern corporation, you need to know how the brain works as well. So these are the 12 important rules that both the teacher and the learner have to know and practice as well. So we can deliver the best from exercise and sleep and breaking up stress and so on. Otherwise, we can end up with stress, which is reported. The last few years is this is one of the paper came in 2016. The learning and memory is under stress implication for the classroom. And then the prevalence and association of stress with sleep quality among medical students, they reported, because they find it difficult to cope with their workload and stressful environment. And this has been reported as well. And the global prevalence of anxiety among medical students, this is came with a few years ago as well. And again, stress in medical students. So all this have been reported. So our students are going through a lot of stress. So using the cognitive load and how would we manage our lectures teaching can be useful in order to address this issue. And also, this is a paper a few years ago, 2019, reported about depression among health science students in Malaysian, the public university as well. So our students are stressed out. Okay, this is a very important issue we have to address as well, and we have to know how to deliver our material so the students can actually can maximize the teaching and learning as well. There are also other papers which you can find in the web. These are some of them. Okay, and generally, like moderate stress is important for learning, but high stress is not. It can block learning as well. So overall, I just like to coin this word, like education needs to be more organic. Okay, it's more brain friendly so that the students can maintain a very good in mental health as well. Now, what about the future? This is just to show you the evolution of anatomy teaching. Initially was using the cadavers. Okay, this is an old the picture. And from here, we went into the using, and it's a dissection form. This is using anatomy. Probably in future, we may have to go into augmented way of teaching and learning. And AI here is it will stay, So we have to cater for that. We have to include and to prepare working with the technology, especially artificial intelligence. Now, so what I did was I asked ChatGPT just a few weeks ago, what will be the future? Since the first part of the lecture, it is my view on this after teaching for so many years. So I thought, let me ask artificial intelligence. Now, what will be the future of human anatomy teaching and learning? So the response I get from ChatGPT is, as an assistant, I can say that the future of human anatomy teaching and learning is likely to incorporate more technology and innovation. Virtual and augmented reality technologies will enable students to better explore, understand the intricacies of human body, and online resources will allow for more personalized and self-directed. So this is answer. This is a response I got. Now, at this stage, even the teachers may worry if AI, are they going to replace the teachers then? I ask this question. Will human teachers be replaced by AI in the future? The response I got was, while advancement in artificial intelligence, the technologies are impressive, replacing human teachers entirely with AI is unlikely. AI can certainly enhance the learning experience by providing personalized recommendation and support, but human teachers offer unique benefits that AI cannot replicate, such as emotional intelligence, creativity, and ability to form personal connection. This is very, very, very important. Because one thing you may have realized when you're teaching online during the lockdown, the teaching was rather impersonal. But when you go to a classroom, the teaching become personal. You can actually personalize your instruction according to the students. However, AI can work alongside teachers to support, enhance their teaching method, creating a more effective and well-rounded learning environment for these students. So a gentle reminder, this is one of my good friend and a famous anatomist, Professor Peter Abrahams. He wrote he and his team wrote a paper a few years ago that a heavy penalty of not concentrating on sufficient anatomy education will inevitably lead to incompetent anatomists and healthcare professionals, leaving patients to dire repercussion. This is very important. That is just a gentle reminder because anatomy is a very, very important subject, and it is very important for students to learn it well so they can apply it to understand, apply it in their clinical practice as well. That because we are training the students to deal with the precious human lives, whether it's going to be a medical doctor or a surgeon or a pharmacist or a nurse or a dental surgeon and so on, this is very, very important. Okay, so anatomy is very, very important subject, and these are the challenges we are facing and need to address these issues. Okay, thank you so much.
Thank you very much, Prof, for the sharing. Okay, I have to agree that our students are much more stressed nowadays, and all these teaching and learning techniques that you shared not only apply to anatomy, I think it applied to the entire medical education. We have one a question from Dr. Yu Quen Chen, who said that maybe it would be good to have more frequent communication or connection with the clinical teachers to flag hotspot areas where anatomy is wrongly learned. I have students saying the cord is anterior to the vertebral bodies, according to him. What is your comment to that, Prof?
Yeah, because we do have students who may have forgotten what they've learned. So it has to be continuous. So education has to be continuous. There's no such thing anatomy finishes in year 1 and year 2. So they need to revisit, and also student must also have the habit of also finding out what's the answer. The teachers are there, we are there to facilitate their learning. So the students must be reminded, they have to be continuously in touch with the anatomy part of their course as well.
Yeah, I agree with that. Teaching and learning anatomy is not just for the first and second year medical students, and this learning together throughout the years is more important. It's the repetition, because when they were learning in year 1, probably their focus is just to remember the facts, and when they're in the clinical postings, they are really applying the anatomy knowledge to what they are learning at that time. I agree with you, Prof. We don't have any other question, but I have my own personal question for you, Prof, if it's not too much to ask. You were talking about the common curriculum, whereby all these different courses, for example, medicine, dentistry, healthcare courses, learn anatomy together in one class. So I just wanted to ask you, what are the benefits and challenges you foresee with this kind of arrangement?
No, the challenges I see when you have a common curriculum, you can have a general curriculum where all the students, like what I mentioned, the medical students, the dental students, pharmacists, and probably the nursing students come together because all of them are going to work as a team, right? But at the same time, after having a general curriculum, you also can have specialized for individual the courses to cater. So that's what I think is a very good idea. Because when I was a student here many years ago, we did have a common, that was in the 80s, 85 to 89. The anatomy program, the course was actually combined the medical and the dental students as well. So with that, we have, first of all, we can reduce the workload of the lecturers as well, so they can focus more into research and publication as well. So, and another thing is the benefit again is the human interaction. This is very, very important because when you're working as a team in a hospital, you'll find all of them there. So having the knowledge, when you speak a common, the language, that is very important. So that's the most important part, having a common curriculum. Now, the logistic wise it should be okay, because rather than running so many courses and so many different examination to do vetting and the marking and all, you rather have one curriculum where the courses, where each and every course can come for attend the lectures and the practical session which are relevant to them. So with that way, it's easier, and they have probably in that we can examine them in modules as well. So rather than having so many different courses and running, that's what is my opinion. on this question. Dr. Ethan?
Okay, thank you very much, Frau. I think I echo what you're saying, that now, at least in University of Malaya, we also now have Health, whereby all these health-related entities are all combined together. So perhaps this is something that we can also look into the future on how to also combine the kind of teaching and learning, to be so that they are all these students, when they are working later, they are in sync in terms of on how much anatomy they know when they're treating the patients. I think that's all from me. There's no other questions from the floor. I guess thank you very much, everyone, for listening up until this point. We hope everyone have learned a lot from the two sessions that we had today. Until next time.
Thank you.